It was a very controlled environment to contain the spread of COVID. My responsibility was to implement a new project to isolate women who lived in communal living arrangements that were unable to isolate should they find themselves COVID positive. And the Y was approached for our facilities to provide a private room with a private bath. We worked with the CS, we worked with a lot of medical professionals. We had nurses come to test the women. We also worked with the originating shelters to continue their intervention work. The majority of the women came with children, women who were around the age of 35 to 40. Mainly immigrant women. The most challenging aspect for these women that were isolated was the fact that they couldn't leave their rooms. The isolation experience is not very pleasant. Having to stay isolated from all contact. We have two very experienced intervention workers, and they were so brave, dressed themselves in protective gear and become face-to-face with women who were COVID positive. The intervention workers were involved with the admission process. They would set up files with the CLSC for medical purposes. They would contact the doctor should there be any questions or concerns about the women's health condition. They had daily interventions with these women and their children, bringing them meals, bringing them activities to keep them busy during the day, allowing them a chance to express their feelings, their concerns, their anxieties. They were just so wonderful in helping these women throughout the whole isolation period. They weren't alone. They were isolated, but they weren't alone. We developed the transitional housing for women that found themselves in between leases. Women were leaving their partners, starting their lives again. Prices seemed to increase as well. It made the search for finding a new home very difficult, and we've been able to assist them in finding secure and affordable housing.